Hi, I'm Dr. Patrick Basu, Associate Professor in Cornell, Weill Cornell Medical Center in New York, New York, and Columbia Presbyterian Medical Center in New York, New York. Today's topic, I'm going to be giving you a very concise review on chronic hepatitis C. Hepatitis C is a viral disease from the RNA genome virus. It's been around for a long time, but over the last 25 years, because hepatitis C was born actually 27 years ago. But from molecular mimicry or molecular footprints, we go back actually a couple of hundred years, and it came from a simian thing, possibly from Africa. Regardless, what happened is it's a blood-borne disease. That means it comes from the blood infection, particularly from IV drug abusers or intravenous injections or blood transfusions, from many causes actually. And from sexual promiscuity, of course, and then male-to-male sex. These are the predominant causes of chronic hepatitis C. Actually, hepatitis C becomes chronic because after acquisition of the disease, 15% actually body's immunity fights for it. And then what happens? The rest 85% goes into the chronic disease. The most important part is this virus has no symptoms and signs. Most of the other viral disease affecting liver, causing jaundice, and liver failure or not feeling well, loss of appetite, itching, etc. But this particular disease, hepatitis C, when you get it, that time there's no signs. Just most predominant sign, clinical symptoms of fatigue. But there are other extrahepatic means besides liver, other manifestations actually. Could be 30% in kidneys, can cause cryoglobin syndrome. Cryo means cold and globin is a protein. So that causes skin disease and kidney failure as well. And then besides that, it can affect some parts of the cognition and brain. It can affect other issues, particularly our gonads or sexual dysfunction. It affects other places as well, but it's not that pronounced like other viral diseases. So what happens when it comes in? It takes up 2 or 3 months over it becomes chronic. The chronicity goes up to 20 years, and 20% people can develop contracted liver, which actually I showed here. This is the normal liver, and this is the cancerous liver, but this is a better site of the liver. This is the normal liver, this is the fatty liver, and this is lumpy, bumpy liver called cirrhosis. What happens with this lumpy, bumpy cirrhosis? Besides that, hepatitis C particularly has one genotype. I'll talk about the genotype. There are actually 6 genotypes. 1, 2, 3, 4, 5, 6. So what happens? 3 genotype actually causes a lot of fat, causes fatty liver, and can cause unmasked diabetes. And hepatitis C can unmask a lot of skin disease and autoimmune disease as well. Okay? So this disease, this virus is actually very dangerous and stays completely indolent, no signs. And then one day, somebody finds out that you have this contracted liver disease called cirrhosis. Cirrhosis means it's fibrosis. So what is fibrosis? When the liver tissue, this normal tissue, is changed or metamorphosed or completely replaced by fibrous tissue. What is fibrous tissue? Simply when you have burn, and after the burn skin gets contracted, it's called either a contracture or burn-induced skin changes or a keloid. So that's exactly happens. In that time, that liver gets shrunken, and that's called cirrhosis. And then if you see, liver is actually, again, a cell which is the mother of pluripotent cells. That means it's kind of a stem cell. So liver cells that reorganize and again rejuvenate. Because of the rejuvenations, liver has a very hard time to die actually. So these rejuvenations actually these are the regrowth and rejuvenations to survive as an entity of liver disease. And that's why there are different kinds. And in this case, what happens, if there's a wrong proofreading in the regeneration module or nodule, so what happens? There is cancer. So hepatitis C in 20 years can develop 20% cirrhosis. This cirrhosis, 20% people walk around with cirrhosis, they don't know. And that could be some other causes, fatty liver, alcohol liver, or hepatitis B liver. And there are certain confounding factors that liver gets quickly fibrous. Number one, men over 40, number 2 HIV, number 3 hepatitis B, number 4 fat, which actually comes from insulin resistance and diabetes, and fatty liver is also done by that hepatitis C virus as well. And there are other things, alcohol and high iron overload, etc., etc. And there are some other passive causes actually, well, hypertension, and they said about cigarette smoking, that induces cancer much in higher rate. So we know exactly. So what happens when liver is contracted, cirrhotics, so blood vessels, you see all the blood comes in, this is called portal vein. And portal vein comes from the small bowel and part of the spleen and kidneys. They take away the blood, and that blood actually is a nourished blood. That means it contains oxygen about 75% and gives and bathes the liver tissue. Once there is contracted liver, so portal vein bypasses. What bypasses causing going to other organs, particularly spleen. The spleen gets bigger, and of course takes certain tortuous route on the stomach and esophagus called esophageal varices. And then the toxic material are not detoxified in the liver, and that material goes to the brain, causing problems of understanding, problems of somnolence, confusion, and then they have tremor, and that's called hepatic encephalopathy. And there are other ways kidneys affect too, because heart that time starts pumping, and then too much of pumping of the heart doesn't refill the distal, means arteries, and those arteries actually are less filled, and that gives you less blood supply to the kidney, and kidney suffers and eventually cause a hepatorenal syndrome, which is a very bad prognosis. And then, our nutritional product, particularly albumin, is made in the liver, is low, and other things, and these cause change of hydrostatic pressure in the system. That's why that time the blood or flow of blood is not held properly, particularly the water part of it, inside the lumen of the arteries, and they disperse, they go into the hollow viscus, which is the abdomen, and that free water there is called ascites. And these are all complications of portal hypertension. So what happens in hepatitis C, out of 20% in cirrhotics in 20 years, then they decompensate. There are two kinds of cirrhosis. One is compensated, second is decompensated. So what decompensated cirrhotic means, you're jaundiced, yellow color, you're flapping, you're confused, a lot of belly fluid, and you suddenly started vomiting blood by rupture of these varices. So that means the vessels, the veins, superficially and tortuous veins, with a huge amount of turgor pressures and less amount of voltage and high voltage. But so these, after is decompensates, what happens in 5 years or 1 year, 5% chance to develop cancer. And then what you need actually, once it's decompensated, it's very difficult to go back and regress. But if it is cirrhosis compensated, you can regress to a normal, near normal liver. So what happens in this time, when they have only way to treat them is liver transplantation, and that's an expensive thing and very difficult. So now how we treat this? Hepatitis C has 6 genotype acid in this country. Genotype 1 is very common. One has even subtype 1A and 1B. Why we said that? Because 1A is very difficult to treat over B. Again, another genotype is genotype 3. It's very difficult. That's mostly in Pakistan. And people on transfusions, they get it. In genotype 4, another kind of difficult disease, virus, and that comes from Egypt, Sudan, and Arabian Peninsula. They're also difficult. Genotype 2 is very simple. Genotype 5 exclusively is in South Africa, and genotype 6 is in huge abundance in Southeast Asia, particularly Myanmar, Singapore, Philippines, etc. So how we treat? Before there was a very toxic drug, injection called interferon, and another drug called ribavirin. It's completely gone because of side events. Next, another generation. Remember, this virus, if you take it as a linear structure like me, so this virus, this side is called a structural protein, and this side is called non-structural protein. In non-structural protein, there are different isotopes, different signatures, like 3A, 4A4, 4B, and 5A and 5B. So every area has a significant importance. Why? When virus replicates, means inside, when virus goes to the liver actually, it spares the nucleus. Liver has another inside, any cell has another inside called nucleus. It doesn't go, unlike hepatitis B and HIV. So what happens? It floats around this called cytoplasm, which is actually a blessing in disguise, because once you cure the disease, the virus, it doesn't come back. That means it is not an archived virus. So what happens inside the cytoplasm, it comes through a receptor, which is a window, and there are so many drugs they thought to stop the receptor. And then after that, they have small droplets called lipid droplets. They thought to stop those lipid droplets. After that, they coalesce to, again, for replications. But their replicatory machinery and machinery have different signature. One is 3A, 3B, and 4 called protease. Number 2, another one called helicase and ribozymes. Those areas not affected. And 5A and 5B called polymerase. So the ultimate machinery is the polymerase. Polymerase have 2, A and B. So there are different oral drugs called DAA, directly acting antiviral. It started second generations now. Now we have a barrage of drugs from different companies, and these have names. Every name, there are big names. Make it simplified. Any names last with Bravir, P-R-A-V-I-R, it is all the protease part. It means CB and 4A. Next one is called ASVIR, A-S-V-I-R. It affects exclusively on 5A polymerase, and then Sofia-UVIR, which is on 5B. So all the drugs now, before multiple drugs, now different companies make it very simple. One tablet, very important. It's a very high viral high barrier. It means once there is replications inside the liver, there is always a resistance. The resistance word has changed. There's called substitutions of the resistance of virological mumbo jumbo. So they have resistance because once you treat with one set of drugs, you can develop resistance. And this is called 5A resistance or protease resistance. And there are different structures and different signature. And 5B is 282, AY 93, 55, 36, 31, 30, all these numbers. These resistance profile, or particularly that substitution part of the resistance, would be difficult to treat. That's why they want you to measure biochemical and then treat. But nowadays, it's very simple. So regardless what happens, if it is a non-experienced person, that means never been treated before, now the new drugs are about 8 weeks therapy, oral once a day, or maybe 3 tablets once a day. There was not any other adjuvant therapy whatsoever, and there are things much more compliance, and even in HIV. So there are some drugs they have to monitor with HIV, but they are simplified entire algorithm of treatment and barrage of drugs which should not be used with this, very simplified. Even HIV, there's one drug actually having 3 components. So it is, again, no matter how you cut it, and people who are cirrhotics or failed therapy before or resistance, you can go up to 12 weeks. So 12 weeks of therapy, and whatever the company's medications are, actually, the end products, that means sustained viral cure. Before we used to call sustained viral SVR, but now we have pretty much cured. So what happens is SVC, about across the board, on the board, statistically, goes up to 98%. If you say 97 and 100%, but again, new drugs that actually come up qualify 97.9 to 100%. So if you take even 8 weeks, or if you have prior therapies and cirrhotics, in 12 weeks, then again, comes up to again 97 to 100%. So now we don't have to worry, but we have to find exactly the diagnosis. Remember, there are so-called 5 million people have hepatitis C in this country, but there are some doctors still believe that there is no cure, 9% doctors. But now we just propagate the message all over globally, and every doctor, every houses, even on TV, anybody ever had drug abuse, even recreational abuse, anybody intranasal cocaine abuse, anybody had unprotected sex in many partners, or male sex with male, or intravenous drug abuse, or transfusions, or even dirty needle tattoos, or unusually unfortunate needle stick, they should go. And there's an age called baby boomers, 1945 to 65. Anybody in that age group, it's mandatory go to your doctor, test it, because if you test it, if you find you have hepatitis C, before it develops all these complications I mentioned, take the medications 8 weeks or 12 weeks, and now we have a wonderful cure rate of 97.9 to 100%, regardless what your clinical status. So now, take home message, if you think you have done by this time any forms, all these factors which can bring hepatitis C, if you are somewhere in military, if you were somewhere by mistake, happen to have a needle stick, particularly people who are in the medical professions, anywhere, go have a simple blood test, just hepatitis C antibody, and then after the antibody is positive, then go to any other specialist to do the measure, the quantify exactly the viral count called RNA, and then of course you have to do the genotype, because genotype again dictates many things, but the new drugs are pan-genotypic, means 1 to 6 all, no problems with this. Getting simpler and simpler, and therapy is effective, and now we come to the end that there is cure. So once your cure means you stop the progression of fibrosis, which is again I show you from this liver to this liver, and then this is cancer. And once there is liver cancer, and it is difficult because if the cancer tissue, the cancer is over 5 centimeters, or 3 tumors over 3 centimeters, is bad news. It's called Milan criteria. It's very difficult, and then you have no chance of transplantation unless you downsize. There are many ways. We have giving injections, insert chemotherapy in the liver tissue tumor, or we have a tiny thing called microsphere, called yttrium, that gives slowly uniformly chemotherapy to the tumor and shrink the tumor, or we can use radiofrequency ablations to downgrade the tumor, and there are some algorithms. You get transplant. So again, post-transplant, lots of medications to take, and you have to have the surveillance. So hepatitis C, when it's cured, if you are cirrhotic, if somebody is cirrhotic, you have to do every 6 months a sonogram and a blood test for liver cancer. Again, cirrhotic tissues, regardless of the status of hepatitis C, you have to be careful. There is a screening, okay, for cancer every 6 months, regular sonogram, and hepatitis C, HCC means hepatocellular carcinoma, the tumor screening. And that's all for today. I think I spoke a lot, but if you have any questions, please go www.gastrospecialist.com. www.gastrospecialist.com.